Hello everybody, Dr. Randy Wurts in Thrive Chiropractic. Hey, this is a very serious topic when we talk about our kids today is Autism Spectrum Disorder. Now, it definitely affects the brain and its prevalence rate is on the rise, definitely on the rise. In fact, in 2000, it was 1 in 150 children would have this. In year 2014, 1 in every 59 children would have a prevalence rate of this. So you see that it's definitely on the rise, more occurrence, and a lot of people will say, well, it's genetic, it's the genes. Well, that's less than a generation, less than 15 years. Our genes do not change that fast. Our bodies adapt to an environmental stimulus or environmental conditions, which in my opinion, that's what's happening. There is something in our environment that we're not able to get over, and it's affecting our nerves, because that's what it definitely affects, and more specifically, it affects our brains. And there's a lot of evidence and a lot of research on this. I can do probably a part 1, a part 2, and a part 3, and so on this topic alone. But you know, for the sake of just getting familiar with it, I want to keep it nice and brief so you have a better understanding, and hope it gives you some leeway of what to do. So autism spectrum disorder is actually something, it has to be a multifaceted approach. There's many things that can be a problem relating to this. In fact, moms, when asked, you know, it's not often diagnosed until about 3 or 4 years of age, when kids start to socially interact, they start to engage and learn, and it's really not evident until then. But this is the issue. Moms had a suspicion of this even in their first year, before they were even started to walk, that there was an indication that there was something wrong. So the visual eye contact, or they're just not hearing correctly, or fine motor movements aren't processing correctly as well. And even relationship interaction. Do you smile when I make eye contact? Is there laughter? Are you interacting with me? Even as a baby, we start to see that at the age of 3. And there's a test that I do in the office called the head leg test, where you actually pull the baby up, and you want that baby to be able to hold their head up by the age of 3, 4. Definitely by the age of 4, they should be holding their head up, and it shouldn't be rolling back when you do that. And it's a test that I do here in the office, and it's I see kids like this, and we catch it early. It doesn't become a problem later on, because these kids have a 70% chance of having autism. Maybe not because of that, but it's just showing, hey, there's some weak muscles. Let's get this working, because we know that the muscles in the upper neck very much stimulate the brain and the development of that. And it has to start there first with these children. So movement is very key. They also can have retained primitive reflexes, meaning these reflexes are something they were born with, like gripping, or you stroke one side and they're gonna start turning and saying, where's the food? Even on the foot, you'll start to see them like splay their feet out. It's not ready to walk, but you don't want them to have that by the time they're 1 year of age, because they want them to walk by them. And some other reflexes along the way. The reflexes geared for survival. They have no control over whatsoever. It's just instinctive, and it helps the body survive, that baby survive for the first year. But you want those to go away. If they're retained, they can't develop past that reflexes. They can't develop past those, and learning is an issue, and social bonding is an issue, and you're stuck. Now, nutrition is a very big part of dealing with kids and with autism spectrum disorder too, because we see that when we eat pro-inflammatory foods like sugars, our dyes, our milk, our wheat, when they eat a lot of that, it affects their brain. It increases inflammation in their body. They have a hard time dealing with this, and actually the gut is affected as well, because their guts aren't really developed as well. So counteracting that with omega-3s, doing a detox, eating foods that are rich in alkalins, like vegetables and fruit, but those are very hard. The reason very hard, because they're very texture oriented. They like soft foods, because their coordination in their jaw isn't really good, so they end up biting their tongue or biting their cheeks, because they can't coordinate, and it's easier to chew soft foods in that manner. Especially brain and getting the nerves working. Those are big issues as well. Hey, the nervous system, as far as the chiropractic goes, we'll see kids in here with autism, and the big part of that is what we start to see is when you open up the nerve channels, you're allowed to incorporate movement. Brain balance achievement centers are great for this, because they start balancing the brain. Now, what happens is the brain's not developing on one side of these children, specifically mostly the right side, and the left side is really taken off, so there's an imbalance, okay? Some of these kids are brilliantly smart when it comes to this, but as far as social interactions, they just don't have it. And it's really a challenge for them. And it's sensory overload, and something that we can process, that's not an issue. These kids can't process. Eye contact can be hard for these kids because they don't know how to socially interact. So that's a problem. But when we introduce nerve stimulation, like chiropractic care and movement, these kids will start to get better along with nutritional guidelines, and they start removing past their retained reflexes. Then bingo, we are on. But the earlier they detect this, the better. So get your kid checked. If you have any suspicions, mom, use your intuition on this. I'm going to challenge you moms to use your intuition because, a lot of times we just dismiss stuff, but if you have a suspicion that something's not right, usually there is. So go with your gut on this, okay? And find answers. Now, we can curtail this a lot easier at the beginning rather than when they're at 3 or 4 years of old, when you have to go to the doctor to get a diagnosis, when you had a suspicion when they were 1, and a lot of things can be caught then and maybe really turn out to be perfectly children with no problems at all, or very minimal delays at all. So if you do have any questions, please, I'm available. I want to be a resource to you. By all means, give me a call up, ask me questions. That's my job as a doctor, is to provide resources and a servant to those people that need help and that they just don't know where to turn. And maybe if I can't help you, I'll find somebody that definitely can, as far as one of my connections and resources as well. Take care. You families that have kids with autism, my heart goes out to you. I know it's sometimes very challenging, definitely challenging for the child as well. Okay, take care. Have a wonderful day.